Hello, this is Dr. Boyce. I am the pain specialist physical therapist with the pain clinic here at the DCVA Medical Center. Many times patients come to us who have been to see physical therapists before. Sometimes they get really good results, but a lot of times they say they got good results, but that just didn't seem to last. Other times they say they only noticed minimal benefit, or every now and then they even say that no matter what they did, their pain always got worse. Within the field of physical therapy, we have learned that treating chronic pain in the same way that you treat acute pain doesn't seem to work. That's why specific protocols to address chronic pain conditions had to be developed. If you think that specialized physical therapy for chronic pain will be the same as other programs that haven't worked for you before, you may be pleasantly surprised. In this video, we're going to talk about a specific chronic pain condition called a chronic radiculopathy. A radiculopathy is commonly referred to as a pinched nerve. Now, if you have not yet watched parts 1, 2, and 3 of the pain education videos, I suggest you pause this video and do so now. You can access these videos by visiting the YouTube website and typing DCVA Pain Clinic Pain Education Video into the search bar. You should then be able to scroll down and find the links to the 3 videos. Please keep in mind that the information and strategies included in this video are specifically relevant to chronic radiculopathies. Chronic means that the symptoms have been going on a long time, usually for a year or more. The things you do to address a radiculopathy that is chronic are different than when a condition is acute. A radiculopathy refers to pain that originates from either the neck or the back. There also tends to be pain, burning, numbness, and tingling that radiates down the arm from the neck or from the back down the leg. Usually symptoms will radiate down one side, but sometimes they can radiate into both arms or both legs. Let's talk in more detail about what kind of situation may lead to a lumbar or cervical radiculopathy. Some of you may have heard about how the spine is made of a bunch of bones that are stacked on top of each other. We call these bones vertebrae. The bones of the neck are called cervical vertebrae. The bones of the upper back where the ribs attach are called the thoracic vertebrae, and the bones in the lower back are called lumbar vertebrae. These bones surround and protect the spinal cord, which is like a big flexible bundle of tiny pipes or cables that carry all the signals from the brain to the tissues of the body, and all the signals of the tissues of the body up to the brain. Between each vertebrae, there is a space where small bundles of those tiny pipes or cables branch off of the spinal cord, exit the bones of the spine, and go out into the tissues of the body, forming what we call peripheral nerves. Here's a little hint about medical terminology. Anytime medical providers talk about the nervous system and say the word peripheral, we're talking about a part of the nervous system outside of the spine and the spinal cord. If we say central, we are talking about the spinal cord and the brain. Anyway, these nerves carry signal back and forth between the tissues of the body and the spinal cord. We call the part of the nerve that branches off of the spinal cord and exits between the vertebra a nerve root. Here we have a nice close-up view of the space between 2 vertebrae where a nerve root leaves the spine to eventually join other nerve roots and form a peripheral nerve. The vertebrae in the center is the 4th lumbar vertebrae. We call it L4, and it is sitting on top of the 5th lumbar vertebrae called L5. Between L4 and L5 is the L4-5 disc. This provides mobility, cushioning, and also helps create some space between the vertebrae for the nerve root to leave the spinal cord to go out into the tissues of the body. The nerve root that exits between the L4 and L5 vertebrae is called the L4 nerve root. In this model, you can see that this nerve root has lots of space. But over time, the disc and the joint degenerate and this space starts to decrease. It is important to keep in mind that this is normal and occurs with everyone as they get older, even when people don't experience any symptoms. Sometimes, though, the nerve root gets crowded enough that it starts to produce a lot of irritable signal that travels up to the pain neural signature. The pain neural signature will then start to develop a sense of threat about that nerve root, and the person will experience the pain, burning, numbness, and tingling that we had talked about before. A similar situation is true for the bones of the upper back, called the thoracic vertebra, and the neck, or the cervical vertebra. There are spaces between each vertebra where the nerves come out. If they get too crowded over time, they will start to produce a lot of irritable signal as well. In addition to a nerve root being crowded, sometimes there can be a lot of inflammation around a nerve root, which will also cause it to send a lot of irritable signal. This can come from the disc in front of the nerve root or from the joint in the back, and this joint we call the facet. There are some things that can be done to help reduce these primary faucets of irritable signal. Anti-inflammatory injections can reduce inflammation. Certain movements, stretches, and traction can give a nerve root space. And sometimes, if there is so much narrowing around the nerve root or the spinal cord that there is a threat of permanent nerve damage, a neurosurgeon or spinal surgeon may need to remove parts of the disc or even the bone to give a nerve root space. There are also other procedures that are performed to try to calm down the irritable signals or knock the nerve root out completely. Sometimes these things are effective, and that's great, but those of you who have watched the pain education videos already know that when it comes to radiculopathies and pain, and especially when pain is chronic, there is much more going on between the body and the brain than just these primary faucets of irritable signal. If someone has a history of a nerve root being irritated, and the pain neural signature has developed a sense of high threat value to that part of the neck or the back, the pain neural signature will tend to protect, guard, and maintain a state of hypervigilance about that area of the body. When the muscles around a spinal segment guard and someone maintains a hypervigilant posture, this will actually crowd the nerve root even more. This will also cause trigger points to form in the muscles, producing more nociception. If sleep is continually disrupted, the tubs of the pain neural signature will not drain very well. Mood is often affected, the stress centers stay activated, and this can even increase the likelihood that tissues will stay inflamed. Remember that the nerve root and peripheral nerves are a part of the nervous system too. They can also undergo adaptive changes and become sensitized. Now it might not take very much crowding at all for them to send irritable signals. Mood, thoughts, beliefs, fear, anxiety all affect each other. And you know what? They affect our behavior as well. When we avoid movements that involve the tissues surrounding a nerve root, the supporting muscles become deconditioned, and the connective tissues around the nerve root become stiff and tight. This will cause further crowding around the nerve root. As long as the pain neural signature maintains its threatened state and the secondary faucets keep overflowing the tubs, it won't matter how many times an anti-inflammatory injection is delivered. Pain, numbness, tingling, all the symptoms associated with a radiculopathy will persist. So what should a specialized physical therapy program for a chronic radiculopathy look like? For starters, you want to give the nerve root what it needs. All nerve roots need space and movement to supply them with blood, oxygen, and nutrition. When a nerve root doesn't get what it needs, it will send lots of irritable signals to the brain. But you can't expect to provide space and movement if the pain neural signature maintains a high threat value assigned to the area around the nerve root and is constantly creating tension and guarding to protect it. Being able to reduce trigger points can be helpful too. Receiving trigger point injections, having dry needling, acupuncture, deep tissue massage techniques can provide wonderful temporary relief. But remember, trigger points are produced by the nervous system and are incredibly dynamic. As long as the pain neural signature is in a threatened state and the nerve root stays sensitized, they will tend to come and go. This is why it is so important to also learn techniques to address trigger points that you can do on your own. It is when a physical therapy program specifically targets the pain neural signature as well as the tissue surrounding the nerve root that makes it specialized for chronic pain conditions. Whether a program is effective or not lies in the details of how well the patient is able to take control of their program, and that will determine whether the pain neural signature will undergo adaptive changes eventually de-threaten, and long-term benefits will be experienced. Here are some specific treatments that will be part of a specialized physical therapy for chronic pain plan of care for chronic radiculopathies. They will help you de-threaten the pain neural signature, reduce protective bracing, guarding, and tension around the nerve root, effectively control trigger points, and provide the nerve root with space and movement. Regular performance of relaxation, deep breathing, and mindfulness techniques can help keep the tubs drained. By engaging in our interdisciplinary self-management for pain telehealth program, you will be introduced to some of these techniques, along with many other ways to effectively take control of your pain experience. There are also other resources on how to learn these techniques. Check out the VA Whole Health website and the VA Pain Management website to access online apps and instructional videos. When relaxation techniques are also combined with stretches to reduce stiffness and tightness of connective tissues, a huge faucet of irritable signal can be turned down. The educational materials in our Self-Management for Pain telehealth program include general guidelines for stretching with relaxation. You can also receive further individualized guidance through telephone or video connect appointments with a pain specialist physical therapist to teach you how to specifically target the tissues around the nerve root with these stretches. These stretches will open the facets and provide the nerve root with that much needed space. Have you ever heard the phrase, motion is lotion? Mindful movement, mindfulness, and guided imagery can help reduce the threat value assigned by the pain neural signature to movement of the tissues surrounding a nerve root, while at the same time providing the nerve root with movement, blood, nutrition, and oxygen. There are simple guidelines that can break you out of the pattern of pain-producing hypervigilant postures and teach you how to achieve a healthy balance between use of protective postures for heavy lifting and intense physical activity, and balanced and relaxed postures for restorative positions like sitting, sleeping, and relaxed standing. It's also important to learn how to perform self-massage and deep inhibitory pressure techniques to provide better trigger point control. Of course, we want our brains to always maintain good production of endorphins and other molecules that improve mood and improve pain control. We also want to improve and maintain overall health and cardiovascular endurance. Again, our Self-Management for Pain telehealth program also includes general guidelines for pacing and progression of cardiovascular exercise that are specifically targeting chronic pain conditions. To help ensure long-term changes, it is also important to learn how to achieve a good balance of functional movement, stability, balance, and strength of core muscles and functional movement patterns. When these skills are mastered and implemented, you will notice a reduction in the frequency, duration, and intensity of the pain, numbness, and tingling that radiates from the neck out into the arms, or from the back out into the legs, and even the pain in the neck and the back themselves. Keep in mind that specialized physical therapy programs for chronic pain should only be part of a whole in controlling any chronic pain condition. Sometimes medications are needed to reduce peripheral nerve and nerve root sensitization. Sometimes specific behavioral therapies are still needed to address PTSD, depression, anxiety, and sleep. Sometimes a surgery is needed to preserve a nerve root or prevent permanent damage to the spinal cord. This is why a comprehensive multidisciplinary approach is often needed to really take control of all the contributing factors that are involved in any chronic pain condition. If you are interested in working with a pain specialist physical therapist to help you develop a program to address a chronic radiculopathy, I first recommend that you engage with the DCVA Medical Center Pain Clinic's Self-Management for Pain telehealth program. There you will learn the general guidelines for activity pacing, pacing and progression of cardiovascular exercise, relaxation techniques, and stretching with relaxation. You can then reach out to the pain specialist physical therapist and learn ways to more specifically target the chronic radicular symptoms.